Hello, everyone. I am Professor Maria Vittoria Dieci, and I'm Associate Professor of Oncology at the University of Padova and Istituto Oncologico Veneto in Padova, Italy. Today, we are going to delve into the continuation of a patient case initially presented by Professor Vidal in our first video of this series. Let's begin by revisiting Monica's case. Monica was diagnosed with ER-positive, HER2-negative metastatic breast cancer in 2021. To manage her condition, she was prescribed letrozole and ribociclib as her first-line treatment, and she progressed in 2023. Subsequent ctDNA results revealed an ECR1 mutation, a common occurrence in such cases. Following current recommendation, Monica was prescribed Elacestrant. Now, let's explore what to expect after prescribing Elacestrant. Today, we are going to take a closer look at patient-centered outcomes. Patients in the EMERALD trial completed 3 patient-reported outcomes tools. The first tool, the OTC Quality of Life Core Questionnaire, included 30 questions across 5 functioning domains, 3 symptoms domain, and the Global Health Status Quality of Life domain. Results showed that scores were similar for Elacestrant and standard of care, with no differences across all time points for functional, symptom, and Global Health Status Quality of Life domains. For the PRO-CTCA, the questionnaire focused on subjects' reports of the frequency and severity of adverse events, including nausea, fatigue, joint and muscle pain, and hot flashes. Results showed fewer patients reported severe nausea and vomiting with Elacestrant as compared to standard of care. For EQ 5D 5L, there are 5 questions assessing 5 dimensions in regards to their severity as well as general health. Results were generally comparable in all patients, Elacestrant as compared to standard of care, for mobility, self-care, and usual activities. So it can be concluded that quality of life was maintained between treatment groups. But what happens when one of our patients experiences an adverse event on Elacestrant? For Monica, after 6 weeks on Elacestrant, she started experiencing grade 2 nausea. Treatment modifications for adverse events management include dose reductions or interruptions. We currently have 3 levels of Elacestrant reductions. If there is ever a need to go beyond the 3rd level, Elacestrant should be permanently interrupted. If a grade 1 adverse event occurs, no treatment modifications are needed. If grade 2, interruption may be considered until recovery to grade 1 or lower or baseline. For grade 3 or 4, interrupt until reaching grade 1 or lower or baseline, then resume at the next lower dose. If a grade 3 adverse event reoccurs, then restart at 2nd level dose reduction. But if grade 4 reoccurs, it is recommended to permanently discontinue Elacestrant. For Monica, drug was suspended for 1 week and then restarted at the same dose. It is important to remind our patients to take Elacestrant with food in order to reduce nausea. No grade 2 or higher adverse event occurred thereafter. So once we have addressed the adverse events, the next question we are going to discuss is what happens after progression under Elacestrant. Let's say that in 9 months, Monica progresses. According to the ESMO 2023 Living Guidelines, considerations for treatment in the 3rd-line setting should take into account sensitivity to previous treatments received, time to progression, germline BRCA status, tumor biology, and mechanisms of resistance that may have arisen during previous treatments. In this context, ADCs represent a new valid approach. For example, for patients with HER2-low tumors, trastuzumab deruxtecan is effective, as suggested by the overall survival benefit observed in the DESTINY-Breast04 trial. For HER2-zero tumors, sacituzumab govitecan is an option based on the results of the TROPiCS-02 study. Although Elacestrant was the first oral SERD to be approved, multiple phase 3 trials on oral SERDs are also ongoing in the metastatic and early setting. For metastatic breast cancer, trials include the SERENA-6 and 4 exploring camizestrant, EMBER-3 investigating imlunestrant, as well as the EVERA and PERSEVERA trials investigating giredestrant. In the next coming years, we sure hope to see the treatment landscape evolve even further. Thank you all. We hope you found this video informative And if you want to have a closer look at the data discussed today and more, please download the accompanying slide deck.